Manqoba, the Helen Joseph Hospital in Gauteng. What have you found out there?
Well, Jen, we've spoken to a number of healthcare workers across the province, of course, who are not painting quite a good picture about the state of hospitals in the province. Many of them saying that issues of overcrowding, issues of staff shortages, as well as a lack of resources continue to be a problem for many of those frontline workers. And in fact, saying that working in some of these public hospitals is a daily nightmare due to some of these issues. But I'm just going to paint you a picture of what it is exactly that they are saying. I just want you to take a listen to this snippet, which I'm hoping also the MEC, the acting MEC of Health here in Gauteng is going to listen to, so that we can talk about some of these issues, Jane. Let's just first take a listen to some of those sentiments that were echoed by some of these healthcare workers.
It's a nightmare. Every day when you wake up, you wake up knowing that you are going to a 45-bedded ward with 45 patients. 16 of those patients are critically ill, and you are only 4 on duty.
It's a psychological trauma. To an extent that when you are on annual leave or when you are on your rest days, you don't want to go back the next day, because you know the challenges I left, I'm still going to find them or even more.
Well, we're now going to speak to the MEC of Health, Jacob Mamabolo here, who joins me now. MEC, what are concerning issues that are being raised by some of the healthcare workers, issues of overcrowding, issues of lack of resources? And certainly these are concerning, if anything, isn't it?
Well, let me say that the health facilities in our province are working and are running very well. However, that does not mean there are no challenges. And remember that we are managing big numbers every day. And if you also consider neighboring provinces as well, most of the people do come inside our province. So, and we don't have all the resources that are required to do the work. So the concerns of the workers, to a certain extent, yes, they will be correct. There will be challenges. We do acknowledge that. We have never denied that. We have actually always been the ones that says we do have challenges and we acknowledge them. But the healthcare facilities are working. We're providing an excellent service, good quality healthcare. And to that extent, we're always balancing, the two issues together. But in the main, and the dominant trend is that we're running a very stable public healthcare system.
But MEC, the healthcare workers themselves are saying it's not stable at all. In fact, they're saying that it is a nightmare. It's a trauma to work in some of these hospitals because these issues are simply not being addressed. The situation is a long-standing one, but nothing is changing. Why is nothing changing?
So let me just also clarify that just this Saturday, a day before yesterday, we held a workshop with all our 37 facilities at our provincial command center. And we were trying to look at our resurgence plans and what are the challenges that are there. So as I'm saying to you that we were never in denial that there are challenges, but the health system is able to provide service. And you can look at the rate of recoveries, you can look at our output and performance, but it is, and also the issues of PPE. We have dealt with the issues of PPE quite substantially. If you check where we used to be with PPE and the issues that used to be raised. So the fact that there are those issues, it doesn't make them the dominant trend. There are exceptional cases of problems, and we're not in denial about them.
Okay. And then would you agree then that if they're raising such issues where there is lack of equipment, where they cannot do their jobs, that you are perhaps failing them as government?
I wouldn't say that. In actual fact, just today I'm here at Helen Joseph, and that's part of the work to check is the hospital compliant. And you'll have seen at the entrance the level of alertedness and readiness of the hospital. So we continuously work to improve, but I wouldn't actually say that we are failing the workers. On the contrary, I think in the structures and platforms that we have created, and in my last interaction with the workers themselves and the meetings we hold with organized labor, It has not come to us, the situation that it's been painted. As far as we are concerned, we've got very good working relationships with workers. But having said that, I will make sure that we check, and we'll make sure that we talk to the workers again, check if there's been any drop in whatever work we're doing. So the issues that the workers are raising and our own frontline workers are actually a call to us to intensify our work. So I commit that we will improve, we will engage, we'll talk to them, we'll check, because there must also be clear pointers in which areas, so that we can be able to attend to them.
Okay, thank you. Acting MEC Jacob Mamabolo speaking to us there, making a commitment, Jane, to listening to those issues that healthcare workers are raising, and of course saying that he will be meeting with organized labor as well as some of those healthcare workers, just to try and get a sense of what it is that they are saying about the situation in hospitals here in Gauteng.
All right, Manqoba, let's go over to Monique.